we've become that conduit to help them get things from the community that normally they would not be able to get. Cancer Awareness Network is one of those organizations that not only help with the resources, but we actually go into patients' homes and clean homes and just try to make them feel good as they walk through this diagnosis. And we also found out that once you get the diagnosis, because we're both cancer survivors, Tia with My Style Matters, and myself with Cancer Awareness Network, we're both cancer survivors. And so we know that once you get the diagnosis and you go through your treatment, life shifts and it changes. And so there's a whole another world that's out there that we'll have to deal with as cancer survivors. And so we just want to be able to bring something to the community, because in our local communities, we have workshops that we do, right? And so now we can't do those because of this pandemic that's going on. So we came together and decided to do a series of talks with doctors, scientists, healthcare providers, and just cancer survivors teaming in to try to share stories and how to get through this turbulence. I think we're still kind of waiting on our speaker right now, so I haven't seen her name come up yet. So I just wanted to just kind of talk about briefly some of those things. I see several people on the group here that have worked with me personally, and I thank you for signing in. I just saw Dr. Phyllis Mark has joined us. And so with that, hey Phyllis. And so with that, what I want to do, she's actually muted. Phyllis is the second speaker that we've had in our series. We had one last Friday, Dr. Otis Browley, and now Phyllis is joining us. Phyllis is a doctor here in the Birmingham metro area. Dr. Phyllis Mark is a clinical psychologist who has lived and practiced in the Birmingham for over 20 years. Even she's from New York, but she never lost that accent. She has been in private practice with Grayson and Associates, specializing in conducting therapies with adults suffering from trauma, depression, anxiety, deaths, and dying issues and chronic illness. For the past 3 years, she has been a member of UAB Integrative Health Clinic, which is a part of the hematology oncology clinic of the Department of Medicine. She conducts individual, group, and couple treatments, and she also is a trained secular mindfulness meditation instructor. She has participated in research to look at the role of how mindfulness can help people with cancer have a greater sense of personal worth and empowerment. It is my pleasure to introduce to you Dr. Phyllis Marks. And I met Dr. Marks at a retreat last year. And one of the things when Tia with My Style Matters and I got together to talk about this, we wanted to include the whole gamut of experiences that cancer patients would have. And so I thought of Dr. Phyllis and asked her, and she was so glad to join us for these talks. So with that, I'm going to release it to you, Dr. Phyllis, and thank you and welcome to the talk.
Well, thank you, Loretta. It took me a minute to get my Zoom link together, so I apologize for being a couple of minutes late here. But I'm very pleased to be here and to get a chance to talk with you and hopefully be of some help about the many stresses that I'm sure you're all going through, but in particular when that stress is in a crisis situation. I'm kind of curious. I can't see most of you. I see about half of you. Those of you I can see, how many people here are people who have had cancer in their bodies? Okay, or caregivers, okay, or healthcare people? Okay, so primarily people who have already had cancer or who are currently dealing with cancer. That's important to know because everybody goes through different crises, right? There's lots of different kinds. We have one going on right now called Corona, which adds to pre-existing stress and the sense of crisis. But you know, whatever it is, it's important to know that there are these layers of stress that people go through. You can have chronic stress. You can have situations that you're dealing with on a day-to-day basis. You can also have something acute like what we're dealing with the virus. But it's important to know how to respond to what's going on in a crisis or stress situation versus react. Reacting is impulsive. Reacting is kind of like if you get a mosquito bite, okay? If you get a mosquito bite and it itches, right, people scratch. What happens when you scratch it though? It can get inflamed, right? The itch lasts longer, but we do that impulsively. We just scratch. But if you have the same situation, you have a mosquito bite, and you know that if I scratch, it's going to make it worse. So I'm going to just deal with it right now and not scratch. It'll go away faster. So that's the difference between a reaction and a response. And very often when there's stress, we tend to react rather than respond. And then we can make a difficult situation even worse. So hopefully what I'll be talking about here is more about how to work with the stress so that we can take that moment to look at the situation, to notice what's going on, and to respond rather than to just impulsively react and make it harder. But you know, it's important to know that what our terms are, right? So what's a crisis? So I did a little dictionary search, and it says that a crisis is a time of intense difficulty, trouble, or danger. It could be a catastrophe, an emergency, a disaster, a mess, right? It's also a time when a difficult or important decision must be made. So it can be a critical point or a decisive point in what's going on with you. It's important to know that it's a point in time. It's notice of a transition, and crises do not last forever. Usually what happens, even if you have an ongoing problem, it settles into some place where we can work with it in a different way. And that deer in the headlights kind of reaction changes over time, okay? And by the way, if somebody has a question while I'm talking, please stop me, okay? It would be okay. I'll wait for big questions at the end, but if something I'm saying is not making sense to you, please ask, okay? So we know that crises cause stress, but what's stress? A stress reaction, I'm reading some of this because it's easy to give you the real clear definition, is that it can be a biological reaction that's physical, that's mental, emotional, internal, or external. Okay, it disturbs our balance, it disturbs our behavior, it disturbs our thinking. It also can mess with our immune system. Okay, stress will lower your immune system function, which is the last thing anybody needs, especially when you're dealing with cancer, right? What we need is to pump it up. Feeling good actually increases your immune system function. Depression, feeling bad, crises, stress can tend to lower your immune function. So that's one of the reasons why this is so absolutely important, okay? But what one person thinks of as a crisis may not be a crisis to somebody else, right? Your reaction versus your response to significant stress is based on lots of individual factors. It could be your unique body chemistry. It could be how you were doing beforehand, your pre-existing physical or mental well-being, your experience of seeing people in your family deal with stress in the past, maybe your own history of dealing with stress in the past, or trauma, or other crises. We set ourselves up into these patterns of response, or reaction, I should say, that can be really a no-brainer, kind of a go-to when we have a new crisis. So how we have dealt with things in the past very often can indicate how we're going to deal with things now, unless we notice and we try and make some changes, okay? And especially if you have a history of trauma, anxiety, depression, addiction, all of these can predispose you to dealing with stress and crisis in a much more self-destructive way, self-defeating way, So it's important to know what our vulnerabilities are, okay? Not say, you know, I'm going to tough it out and I can deal with this and not pay attention. A lot of times by not paying attention, we cause things to get worse. So I just made a list of some of the things that can happen in your bodies. I don't know, you know, women tend to feel like we can deal with anything. We have to deal with anything. So we may ignore some of the messages that we get in our bodies when there's a crisis or stress. But there's an incredible range of messages that our bodies give us. And you know, when you're not well and you've got all these treatments that you're going through, sometimes it's about trying to just blank out on the messages of your body because it's scary. But these are messages that can empower people, okay? So emotionally, if people are really stressed out, they can become easily agitated, or they can feel overwhelmed. They may not be able to quiet their minds, and it makes it harder to go to sleep. They may put themselves down. Does any of this sound familiar? Right? Some of these things, yeah. You can feel really down on yourself. You can avoid other people. You don't want to deal with other people, right? Those are all emotional indications you may be stressed out. Physically, you can get headaches. You can have an upset stomach. You can have IBS or diarrhea or constipation or nausea that has nothing to do with treatments or other kinds of medication, right? You can have increased pain because when a person is stressed out, we hold our bodies really tight. And when we hold our bodies really tightly, we're going to hurt more, right? That's why Lamaze is so popular, because Lamaze helps mothers to be relaxed so this way they can give birth with less pain. Same idea. When you hold your body tightly, you're going to hurt more. People tend to have more colds and infections because of what I said before about immune system function. You can have a loss of sexual interest. You can be nervous. You can have ringing in your ear. You can have cold or sweaty hands, dry mouth. Your appetite can change. Your sleep changes. All your hair can, you know, you can get hair loss actually from stress. Okay. A lot of times what happens is we tell ourselves, this is more the thinking part. Okay. So we had the emotional, we had the physical, now the cognitive. Our thoughts can be racing, or we can have a hard time focusing, right? Or maybe we can tell ourselves negative things about ourselves because we are just so filled up with frantic energy that we turn on ourselves instead of helping ourselves. So sometimes you feel a blood pressure increase or breathing changes or other physical symptoms. You know, most of these symptoms are not pleasant, right? It doesn't feel happy when you're stressed out or you're in a crisis. So what people tend to do is they tend to push away those feelings. They try to avoid them. They try to avoid recognizing them. But when we ignore these messages, what happens is we get lost. We put another layer on of trying to not feel. So what happens is we either blame ourselves or we blame others. Like we say, if I was stronger, I would feel, you know, I wouldn't feel this way. Or if I wasn't forced to work so hard, maybe I could take better care of myself. Okay, so we're kind of, you know, you ever drive around, you don't want like, to answer a kid's question, you go, look, a bird. So it's like that same kind of distraction. We try to distract ourselves from the actual feelings because they don't feel good. And we layer over our feelings. We're complicated creatures, right? This is not a straightforward deal. I could give you a list of things to do, but I promise you, most people will not do it if they are not paying attention. If they're not paying attention. So it's important to notice your stress. Notice those messages that your body is giving you, whether it's the headaches or restlessness or your thoughts. This is never going to get better, right? It's never going to change. Like with the pandemic is going to change. It may take a lot longer. It's going to take a lot longer than anybody wants, but it will change. A crisis always changes. A new normal may happen, but in this moment, the stress of this intense, reactive kind of, as I said, deer in the headlights kind of shock does change. So it's important to separate your chronic stressors from your acute stressors, okay? Acute stressors may be a recent diagnosis. Fear of recurrence can be a chronic stressor. A new stressor might be, because of the pandemic, I don't know if I can get in touch with my doctor and get my medicine, right? That's a new stress. But that comes from that chronic stress of, oh no, I have to pay super attention to myself all the time because I have to make sure that I do everything I can to work against that recurrence, okay? Another example, if y'all have kids, right? If your kids are home from school or you have grandkids, if kids are home and they're really, really annoying, that's an acute stressor, right? But maybe you're short-tempered because you don't have enough time to yourself. Wanda, you're smiling. I think, yeah, I wonder if you're recognizing this a little bit. You know, it's the kind of thing where it's really about knowing that something is going on here. And the answer is not outside. It's not about what happens. It's about our relationship to what happens, okay? It's about our response. And once we chill and we say, okay, what's important is for me to figure out what can I do? Not that the sky is falling like Chicken Little, right? You know that story, but about what can I do during this time? Maybe I need to go to my room for a while and tell the kids not to bother me for a half hour. You know, maybe I need to call the nurse in my doctor's office and find out what the plan is for the doctor to see people on telemed, for example, which is, for example, what I'm doing with my patients during this time. Okay, and telemed is a really cool thing. It's really helped a lot of people. Okay, so again, it's about layering your stresses, knowing what they are. It's very important to know what they are. Okay, another way to find out information is one of my favorite things, which is called Google. You have questions, you can Google. There are so many answers that I have found of the most obscure stuff on Google. It's very important to be able to realize that people have been through this before. My crisis is mine. It's different for me than anybody else, and yet it's not. So people have gone through this, people have survived this before. What can I learn? What is there available to me that can help me to walk around this issue instead of falling into the hole time after time? We learn, oh, there's a hole. Somebody told me that. I'm going to walk around that one. Okay. So I also made a list. I don't know if we'll be able to share this with you right now, but I got two handouts that I hope maybe Tia, you know, can help us get at some point.
I'll share it now.
Oh, great. Okay. The first one is called Handling Stress in a Positive Way. Okay. So I'm just going to go through this briefly because you can read it yourselves. But the first thing is, as I said, recognize your triggers. Okay. What situations make you feel reactive? Okay. Get under your skin. And once you know what they are, you can figure out a way of coping. Okay. It's also good to manage your time. Okay, making a day-to-day schedule, staying in a structured situation to some degree when you're going through a crisis is so important. It's when you have, like, if you're stuck at home because of the pandemic and you just have nothing in particular to do, but you don't get dressed, or you don't eat on a certain schedule, or you don't do your usual activities, it changes your sense of self-care. And that's really difficult. So managing your time is super important. There are many ways to practice relaxation. I'm not going to go through details with you today, but there's lots of access that you can have. And I'll say something at the end about one thing that you can do as well. But there are lots of stress reduction tools. And you know what it requires? It requires you to breathe. Okay, how many people here are breathing right now? Okay, we're all breathing. It's about noticing how our breath and how our physical bodies are reacting, and then seeing if we can regulate them. Because you have something called an autonomic nervous system. okay? Your autonomic nervous system gives you what's called the fight or flight reaction, which you may have heard of. And when you have that fight or flight reaction, it would be really good if a bear was chasing you down the road, okay? Because it would make you run faster, it may make you strong so you could fight off the bear. But when you're stressed out and you're in a crisis, you have the same reactions, but you can't fight that kind of crisis. You can't fight the crisis like a bear. It's not outside of us, it's in here. So that autonomic nervous system is still giving us that kind of message that we have to get out of here fast or we have to fight. But instead of being able to fight or run, what we do is we work on breathing techniques and we work on other self-soothing techniques in order to relax that fight or flight reaction, okay? Exercise is one of the things that you can use to get that physical tension out of your body, okay? It doesn't have to be really exhaustive. There's yoga for people who have limitations. There's Tai Chi, which is a martial art that you can do in a chair, okay? There's lots of things that you can do lying down, okay? It doesn't require you to be in top shape to be able to exercise or to do the relaxation exercises. Also, setting time for yourself, I mentioned that. If you can go for a walk, or if you can sit outside, even it's a beautiful day outside today, you know, just being able to sit and look at the beauty of the world can remind us that maybe life is going on and we're gonna be okay. Eating well and sleeping are two big time messages, neon messages about if something is not good with us. If we are off our usual eating and sleeping schedule, be aware that that's your body telling you something is wrong. So one way you can help yourself is to eat well, to eat fresh foods as best you can, to try and get enough sleep. And if you can't get enough sleep, if you're having problems, the relaxation exercises can help, but you also should talk about this with your doctor or with a therapist or somebody who is familiar with sleep hygiene, which is what it's called, okay? Alcohol and drugs may sound like they help to chill you out, but they actually interfere with your body's ability to take care of itself. So sorry, we can't find an easy out here. We have to depend on ourselves. Another thing is also to talk to people. You don't have to tough it out. You don't have to be Ms. Macho, okay? There is nothing wrong with talking to people. Many times you're giving somebody else a gift because what you're saying may be something that they felt. And they can connect with you based on that. And it's called mirror neurons. When you say something or feel something and you know that other person gets you, there's a change in our brains. It actually, we resonate with each other. And that's also cut down by the pandemic, but thankfully we have stuff like Zoom. You know, isn't it wonderful? Can you imagine doing this without Zoom? I wouldn't want to, you know, or even with the organizations that, you know, Tia and Loretta are offering things from, these are the kind of ways that we can connect and find people that we have things in common with. And that sense of community really makes a difference. Okay, so that's a handout that hopefully will be helpful for you. Another thing I found, though, is not in addition to how we help ourselves, it's also how do we help ourselves in community. And I found this really cool article from AARP. Yes, I'm over 50, of course. You can tell I'm over 50, so I get AARP. And there's an article in this particular issue called Quarantine Lessons from Outer Space. So there's this woman who was an astronaut who talked about being stuck in a small area with other people for a period of time. And that could be very stressful. That could feel like a crisis, right? You know, you get claustrophobic. You feel like you can't, you know, just have your own space. So she suggested a couple of things, and some of these are repetitive from what I just read. But just to give you an idea, she said, be considerate. When we were in space with the same few people, you had to learn about them and work to help them cope. Then if say you opened up a food container and there was one serving of lasagna, you'd think, oh, my crewmate likes lasagna, so I'm not gonna eat it. Being caring was critical to the mission, okay? So the idea is to not get so focused on, you know, I sometimes should be a 4-letter word. I gets us in trouble. If it's all about me and we get totally wrapped up in I and me and what's in it for me and what can I get and how fast can I get it, we lose our connection with people that I just said is so important. So thinking about other people, putting yourself in somebody else's shoes could be very helpful. And again, that's why support groups like Tia's and Loretta's are so valuable for people. Another thing is to keep your space clean. Who'd have thunk, huh? Okay. In space, they have a very small, capsule. So they had to keep it clean. They had to clean every day and deep clean weekly. Okay. And they were extra diligent about bathrooms. Okay. About washing hands. All these things make us feel more organized internally. I know when I feel, that my house is in order, I feel more relaxed. If I put things away that have been staring at me for a couple of days, I feel more relieved. So making a small effort, even if you just do a little bit at a time, okay? Knowing that you're trying to organize yourself is a big positive. If we're just trying to sit like this and not deal, then of course, all we're doing is putting that extra layer on the stress that I was talking about, right? She said self-isolate is necessary. So they had a quarantine like we have to quarantine, but it's about just giving yourself some space. Maybe prayer can be of help. Prayer with others can be of help, of course, too. Prayer by yourself is helpful for lots of people, or even reading or putting your feet up or watching something funny or looking at social media for a short time. These things can be helpful for us just to change the channel up here, okay? So you don't feel like you're just stuck in this loop, this treadmill and not getting out. She said, get inventive in the kitchen, right? Maybe you just, I call it playing cafeteria. I look in my house and I see, what do I have? And what can I make out of what do I have? And it just use a little creativity, looking at things a little differently. And that's hard when you're not feeling good. It's hard when you're feeling a lot of stress or anxiety. But if you can do one thing differently, it may be your hair, or it may be, what you put on to wear, or it may be what you cook, something a little bit different to just shift that inertia. That could be really, really helpful. Okay. Also, the same thing that we talked about before, which is reaching out to people. Okay. What are we doing here? I see something, but it's not. It's a very cute dog, but I'm not sure. Oh, look at that. Okay. It's got
it's coming out.
Great. Okay. I have a different picture on what I'm looking at. That's why I was surprised. Okay. But it's about exercising, telling people you love them, giving out some compassion, some how are you? I knew somebody who was an incredible person, and she dealt with stress by when she was in the ICU waiting room, when she was waiting for a family member, waiting to see somebody. She would ask the other people in the room, in that waiting area, how are you? Sometimes you get more than you ask for, but at the same time, it can be that you find a way to connect. And I have seen this lots of times in my practice. The way to really get down, the way to get negative, the way to get really bitter is to cut off your connections, whatever they may be. And sometimes, introverts have less desire for lots of people than others, but introverts still want connection of some sort. So find the kind of connection that works for you. I'm going to just finish up with something that is important because as Loretta said, you can take that down to you if you want. As Loretta said, I work at UAB and we're in a clinic called the Integrative Health Clinic. We're a subset of hematology oncology. So I work with an oncologist, conventionally trained oncologist, who is very experienced, but who has also learned some non-medical ways of working with people. And I bet everybody on this screen has, unfortunately, has had the experience of being treated like you're your diagnosis and not a real person. Okay? You may be, okay, you know, there's the lung in room 3, or there's the breast in room 6, you know. That's not who you are. You're somebody who may have had cancer or had some other problem, but you are a person first. And that is so important, because that lack of respect for your wholeness often translates to me not respecting my wholeness. And then you're off, you know, to the races in terms of stress and self-criticism and even depression. But the Integrative Health Clinic focuses on the whole person. So in addition to the medical monitoring and treatment, which is obviously very important, I work with people talking about their emotional issues. Because just because you have cancer doesn't mean you don't have something else going on. Or your adaptation. It may be that you can't work anymore, or your partner is becoming a caregiver and it's changed your relationship, or your kids are not doing things, or they don't understand why mom can't just keep making dinner and keep doing all the things around the house, even though she's, you know, had chemo. There's lots of denial in families. So I work with the emotional side of what goes on for people when they're dealing, whether it's recent diagnosis or ongoing issues or fear of recurrence. Any of that is important. We also have a pastoral care person. We have the oncologist I mentioned is also trained in nutrition. And there's special nutritional classes for people with cancer. We have somebody who teaches yoga to people with cancer. And I think that that information is going to be sent to you by Tia. We have a schedule. We meet on Thursdays at UAB. I don't know where you're located, but I bet that if we have it in Birmingham, I bet there's something like that in Atlanta. Can you hear me okay? I froze for a second there. Okay. So I bet that if Birmingham has something like that, Atlanta has something as well. And I know that's where Tia is based. So I don't know if all of you are local to Birmingham where I am or not. But the issue is that a whole person has more resources to fight, to be good, to find your joy. And we have a Thursday all-day schedule of activities that helps people to do that. And you're doing it with other people who've had cancer. Okay, so they've been there, done that to some degree. And I think that's very important. So that's what we do at the Integrative Health Clinic. And the last thing I want to mention is one particular thing that I do there, which is called mindfulness practice. And actually, everything that I just talked about is about mindfulness practice. It's about paying attention. It's not about playing ostrich. Okay, when we stick our heads in the sand, our butts are sticking up in the air and we're a big target. You know, it's really about when we pay attention, when we get our information, whether it's from doctors, friends, people, other people who've had cancer, organizations, you know, Google, we have more fuel, we have more weaponry to work with what's going on. So mindfulness is a way of stripping away all the fears and the hopes and the stuff that we put onto the facts. And it's about paying attention on purpose in this moment, not thinking about what it was like last year and I wish I was there, or what am I going to eat for lunch after I give this talk, or, you know, either the past or the future is not right now. So mindfulness is paying attention to what's going on in this moment and not judging it, whatever it is. Whatever it is. If you say, oh, I like that chair, and I wasn't looking at you, I wouldn't know what that chair looked like, right? But if you said, oh, I'm sitting in a recliner and it's blue and it's got, you know, a little bit of cushion to it, you know, and I have it in my living room corner, you know, so I can watch television, which is right across the way, you know, that gives me information. So mindfulness is getting information, and our 5 senses give us lots of information. What you see, what you smell, what you taste, what you feel, what you hear. Hopefully, if all of us have some degree of ability in those senses, we get information all the time and we can use it in a creative way to educate ourselves and to stabilize ourselves. So there's a whole bunch that has to do with mindfulness, but that's just like a kind of a reasoning for why it's helpful to do that. And meditation is part of that. Meditation, by the way, is not religious, okay? Meditation is secular. It's about paying attention, and it's part of all spiritual traditions, and it doesn't have to be part of any spiritual tradition. Okay, it's about mind training. Like doing sit-ups is about going to the gym for your abdomen. Doing meditation is like training your mind to be focused and to be able to deal with what's in front of me now. Not what I want to see, not what I saw last year, what's going on right now. You can hear the doctor better. You can also state what you feel better and be more empowered, because if you speak about what your experience is, a doctor is more likely to listen to you. Unfortunately, I knew a lady who had really, really bad cancer, and she'd go to the doctor. And this makes a difference too, because I think it's a racial difference, because she was Black and the doctor was white. And the doctor said, "Hi, Mrs. So-and-so, how are you doing today?" And this woman was eat up with cancer. And she'd say, "Fine, I'm good." She didn't give information that maybe, I mean, I'm not saying the doctor was, going to hear everything she had to say either, because doctors are limited in lots of ways as well. But it was about the fact that she didn't feel comfortable with her doctor. He couldn't say or didn't say the things that maybe would have helped him. And maybe if there was a racial component here, which I think is important, because race and differences in healthcare, that's stress. I mean, I haven't gone through it, okay? Being a woman, I've gone through it in one way, but I'm not Black, I've never been there. But I have heard over and over and seen it happen, that adds another stress. So you have the right to choose people, okay? You have the right to speak up and choose who is going to make you feel like a whole person, who is going to treat you with respect and not as a Black person only, or as in, not that they should forget that you're Black, but they also should not make that their focus, or as a diagnosis, or as somebody that they don't want to see because they're hungry and they have to go to lunch, okay? So you have the right, if something doesn't sit well with you, I really, really encourage you to speak up. Because if we're aware of things, if we practice our mindfulness and we just keep it to ourselves, that's more stress. We need to have some way that we can work with it. And I hope that some of these ways that I mentioned are helpful. There's also mindfulness apps. If you have a smartphone, you can just download free mindfulness apps. And there's all kinds, okay? There's a couple that charge you some money after a while, but just be careful about those. Like Headspace is free at first, and then it'll start charging you after a month or so. But don't use those if you don't want to pay anything. There are free ones that can help you regulate your breathing, as I mentioned. So this way, it helps you to be more chill, it helps you to be more relaxed, which helps you to think better and be more in touch with yourself, okay? So that's an easy thing you can do on your own. If you have problems going to sleep, sometimes those are helpful, because they have these breathing apps that just help you to regulate your breathing. So instead of going to town and thinking of all the things that are gonna, that are painful for you, you're just focused on watching your breathing or listening to a sound or listening to something pleasant. So there are ways of taking care of yourself. I think that is probably the essence of what I would like to say. And I'd be glad to hear any questions that people have, any need for clarification, if there's something I said that didn't make sense to you. I'm just gonna leave it open, and Tia, if you will facilitate that. Okay, so if anybody wants to be called on or whatever, I'd be glad to try and answer.
Awesome.
Okay.
Loretta, yeah, go ahead.
Yeah, I'm going to try to ask these questions that several people have chatted in the chat box. So we kind of went through the questions and looked at them. And so to keep us from being redundant, I'm just going to mention a few of them, if that's okay.
That's fine.
The first one says, during this pandemic crisis, what do you recommend for cancer patients who are scared to go to the office for visits and to get these testing procedures? And I think one of the things that came to mind is that during this time, a lot of people are not getting tested for cancer, which means there's going to be an increased number of patients with cancer who don't know it until it's too late. When we've had this big push to get this early detection and get the screenings done, and all of a sudden now everything is kind of pushed back and on hold.
Yeah.
What are your comments on those things?
It's a very rough situation. There's no easy answer here.
Mm-hmm.
But I do know from my experience with UAB that, and I would believe this of any fairly large hospital, they are doing everything they possibly can to safeguard people. If
Right.
you can manage what your questions are for your doctor through telemed or on the phone or talking to a nurse. Nurses are often more accessible than the doctors, so maybe the nurse can answer questions for you and get names. If you're talking on the phone to somebody, get their name, because then you have a personal relationship and maybe they would be a person that you could talk to again about something. But in terms of going for tests, if there is a reason to get a test done that is something that your doctor, especially really thinks is important, you can go for the test. I have seen the precautions that they're taking at the hospitals. And UAB, when you get off the parking deck, they have nurses that are taking your temperature. Right? You can't even walk into Kirkland Clinic without getting your temperature taken.
Yeah.
Okay. There's also social distancing in the waiting rooms. You can wear a mask, you can wear gloves. Okay. These are protection, but just don't use your gloves to wipe off your seat and then, touch your face. I mean, you have to be aware of how not to do certain things, but there are ways to minimize the risk. And depending on what your options are, it may be necessary to just go in. The nurses, I have some patients who are nurses, and I've worked with nurses before. They are, we've heard it on the TV and radio, they really are the heroes here.
Mm-hmm.
Okay, they are super in terms of their connection between the medical people who are doing the tests or the MDs and the patient. So it's important for you to see that the nurses are taking all kinds of precautions. They don't want to get sick. And the last thing they want to do is to make your life more complicated.
Right.
So it's about checking in. You can call in advance of if you think you need to be tested. What are the precautions being done? How do I get there? How do I make sure that I can sit far away from people? Ask questions. But then if you have to get tested, life goes on even with the pandemic. So it's important for you to get that care that you need.
Okay, thank you.
Sure.
The next comment is from a participant that says, I think for me, it feels like I'm always in fight or flight. I've been metastatic breast cancer for 10 years. I just received a call just now saying that the research center is back open, and my body just automatically went into a fight mode. So I think that's in response to what you were saying earlier.
Yeah. And sometimes what will happen is that, it's like the water we swim in, because if you're dealing with cancer over a long period of time, you start getting used to that constant fight or flight. It's like a low level fight or flight. You're still functioning, but you're tighter than usual or more irritable, or, your eating changes. But when you hear about something that might be a good thing, or might cause, some kind of a change, that's like a mini crisis. It's like, and all that pent up kind of suppressed stress can come to the surface. And that's why you can feel it. Like Loretta was saying, you can feel that. And, it's very stressful. You need support. We all need support.
Right.
We give and we get. So that's a big piece of how to handle some of this.
Okay, thank you. The next question was, it says, well, it kind of moved on me. Dr. Mark, please elaborate on your statement about knowing our relationships to the stressors.
Okay, good question. Okay, what might be scary or difficult for one person doesn't have to be for another. If
Mhm.
I'm walking down the hallway in my office and there's a little corner where other people are coming around, right? And somebody else is coming at the same time that I'm coming, I might go, oh, excuse me. Somebody else might go, you know, and be freaked out because they had a sudden reaction, okay? So knowing that I or a person may have a tendency to react quickly means that our relationship to those situations includes the fact that I need to work with myself so I can take care of myself when those things happen, because those things are going to happen.
Mm.
You know, there's bumper stickers about it. SHIT happens, right? Things happen, but it's important to realize that how we deal can be very different. Somebody can be really freaked out about a hangnail, right? And then somebody else might have, you know, whether it's because of their spiritual beliefs or because of other reasons, they may have some kind of life-threatening procedure that they're about to do, and they're relatively matter of fact about it. So that's what I mean by a relationship. And we can structure, we can help to create the kind of relationship to what's going on that helps us to feel less wobbly, less like that we're going to be thrown
Yeah.
by whatever happens. And again, spiritual beliefs are helpful in this regard. Information is helpful in this regard. Just looking at ourselves and knowing ourselves well really makes a difference.
Okay. I think we have time for one more. We've got about 7 minutes left. We do want to be mindful of the time because we don't want people to get stressed out about that. So the last question that I have is more like a comment, I think. It says, one of my favorite tips is after acknowledging the stressor, recognizing its source, then flip the switch to remove beyond it for however long. Do this as much as you have to for a moment of calmness. Great comment. Many people do realize that they have the right to change doctors or to speak up to doctors. They not only bring their experience, they also bring their lack of experience. So I think that that was more of a comment than a question, but we do want to acknowledge that Tia with My Style Matters have another question or comment that she would like to share. Someone just chimed in uh, another question, and then we'll move on to Tia, and we'll let Tia have the final say on this. Not only might the reaction to stress differ from one person to the next, your reaction can change over time. So
Absolutely.
the question is, what may stress you out today may not next month. That is so true.
That is
And
very
thank
true.
you so much for that comment. So with that, we're gonna allow
I'm going to say,
Tia.
if I may say one more
Oh,
thing. Okay,
sure,
one more thing.
sure.
What's really important is women, we know this because of our relationships to so many people being daughters and mothers and spouses and friends and sisters, but we forget to give ourselves this. It's
Mm,
very important to have compassion
right,
for ourselves,
right.
Yeah.
okay? Because as I think it was Nicole that said this about that stress can change from time to time.
Mm-hmm.
Our situations are always changing.
That's right.
Okay, how we handled something 15 years ago is not going to be the way we handle it now, and that's okay. Or being an experience the way Loretta talked about is also okay. It just means that part of your relationship to the experience may be asking questions. Or before you go to the doctor's office or whatever the stressful situation is, you write them down so this way you don't get agitated or nervous and forget to ask something. So to prepare yourself, to give yourself some grounding is very important, and that can help you with stress as it changes over your lifetime. But those tools can be helpful even if you have different answers or different questions. It's still that idea of compiling the information, giving yourself some compassion, and knowing that whatever happens, you can handle it.
That's right.
Thank you, everybody.
Thank
Thank
you.
you.
Thank you.
Well, I just wanted to first say thank you again for being a part of this talk for us. I really appreciate it. And it was great information. And I know we all could use it because we all deal with stressors, whether it's cancer or anything else that we're dealing with in our life. And two things I wanted to share with you all that are resources. One of the things I started was a daily virtual walk. And pretty much is we're going on Zoom and we do it every day at 6 o'clock Eastern Standard Time. And we just go outside for 30 minutes and we walk. One is to get us off the couch because some of us are just on the couch. The other part is just having an accountability partner. And then there's the support. So if you all want to join in, we do it weekdays, every day, 6 o'clock. I'll post the links in the chat and I'll also email it out to everyone. But it's just a matter of, like I said, you download Zoom on your phone. We go outside and it's, survivors only. And we're on the phone. And oftentimes, we've had different conversations every single time we meet up. And there may be one person that just really needs some love, some support.
Mhm.
And we rally around that person. And we just, like I said, have conversations with one another. Whatever it is that we want to talk about. It could be something cancer related. It could be COVID related. It could be something totally not related to either. But it's just an opportunity for us. I truly believe that no sister walks this journey alone. And that's one of the ways that we do it. And it helps to keep us accountable to each other, right? So even if I'm not on a call, the Zoom is open for you all to just be able to join in, but you have to register because we want to make sure that we don't have any of the trolls, that we've been seeing and hearing about on the platform. But I'll post a link in here for you all, and it's for anyone. It doesn't matter where you're located. It doesn't have to be in Atlanta or Birmingham. We have people, from all over that'll join in. The other thing is at the beginning of June, I've started participating in one, and I'm going to do it again and open it up to others. It's a 21 days of abundance meditation challenge. And it's really been interesting because every day it's a new challenge that you have to do, and you have to post in the group. We do it through a WhatsApp platform, and every day you have to post something new. Some of the activities is just writing down maybe your bills, right? The bills or the stresses that you may have from a financial standpoint. And then there's also sound for you to listen to help you with the meditation. And it only takes a few minutes out of your day to do it, but it really gets you to think about your life and to think about some of the things that really don't even matter. The things that we thought that mattered doesn't even matter. The things that we stress over, it starts to kind of give you a sense of calmness and put some things in order for your life. So I will share those two links in our chat if you all, and I'll email those out as well if you have an interest in joining those. Like I said, the virtual walk is all through Zoom, and we just tell people to download the links on their phones. And then we do it every day, Eastern Standard Time, 6 o'clock. And then the other activity is the 21-day meditation, and we do that through the WhatsApp platform. So if you have that downloaded on your phone, which a lot of people use WhatsApp for international calls, download that. And then every day we post, and then we just say, when you're done with that exercise, you just post in the group, I'm done with day 5 or day 1 or day 2 or what have you. So we'll start that on June 1st if you all want to join in on that. And if you want to eventually start your own 21-day abundance meditation challenge for your friends and your family, you can do that as well, because there is an exercise in there for you to, incorporate other people. So hopefully those two things those two resources will help you. We also will send you the article as well as the link to the AARP article as well.
Okay, and that brochure, you'll be getting a brochure from UAB. The one that Dr. Phyllis talked about earlier. And I've already signed up for the mindfulness and a couple of the others. So yeah, so I'm excited about that. And thank you guys for being here today with us. And we just look forward to the next one. We have another one coming up with Dr. Spencer in this month, which will start our next part 2 in June. And so we have 4 lined up for June, and then another 4 lined up in July. And so we want to thank you guys for joining, and please share the links with your family and your friends. Thank you.
Stay safe, everyone.
And thank you, Dr. Marks.
Bye, everybody. Take care of
Bye-bye.
yourselves.
Take
Bye-bye.
care.
Bye-bye.